Good morning to our beloved lecturer, Madam Mazuin Khamis, and our beloved student from cohort 18. I would like to introduce myself. My name is Alvin from DPH cohort 18. I would like to do individual video presentation for pharmacology 1, PHPG 4122. So let's move in. So the first video is basic of pharmacology. The term has been used in the video is drug receptor. Drug receptor have three components. That is receptor, agonist, and antagonist. The second thing that in the video is pharmacokinetic, that is ADME or drug cycle. ADME is absorption, distribution, metabolism, and excretion. So the definition of each term that used in the video is absorption is the movement of the drug into the bloodstream after administration. One example of the drug intravenous that I choose, and I like to explain about that. It's the best way to deliver a dose rapidly and accurately, as the drug enters directly to the systematic circulation without the delay associated with absorption process, achieving the therapeutic effect faster than other route. So, next. Learning point based on the video given. Based on the video, we learn about drug receptor, agonist, antagonist, and the activity of receptor, drug reaction, and study of side effects. We also study about pharmacokinetics, that is ADME. ADME, what the body does to the drug, absorption, distribution, metabolism, excretion. Absorption is a special delivery into the bloodstream. Absorption route, absorption time, and absorption factors are also in the video. For distribution, have distribution barrier, delivery of drug, blood-brain barrier, blood parenteral barrier, and blood testicular barrier. For metabolism, biotransformation, we study breakdown to the less active or inactive form, an organ that involves as liver of, to the most drug, kidney, and intestine. Furthermore, we study excretion is removing the waste product from the body. The organ that works is the kidney as a main organ, saliva, sweat, glands, lungs, and breast, and accumulation in the video. The second video is pharmacokinetic 2, that is absorption. The term used in the video is the transportation of the unmetabolized drug from the site of administration to the body secretion system, the time of circulation of the drug, and the cause and side effect of the route of administration. The definition of each term that used in the video. The time of circulation of the drug. The most common route of administration is oral. The drug moves over the digestive system and get absorbed by the gut and move to the whole system. This takes some time to slow the rise in the blood concentration and show a fall. Note that the circulation system is too slow and take a long time to the process. The intravenous route will not be taking a long time as oral, but it's the same dose, but the dose didn't go to the metabolism in the intravenous or IV administration drug. The system didn't take a long time because it's going to the heart, lungs, back to the heart, and to the artery. The result, quick rise in the drug concentration. The inhaled form, many of them giving this way the drug now. The drug only goes to the heart and straight to the artery circulation. This means the drug will shoot up very quickly, even if the circulation system is too fast and the time is too short at the route of administration. One example of the drug is oral that I should explain in the process involved in the video assignment. The oral drug is the most common route and the process starts from the flow of blood from the gut to the lower by the teleportal system blood, then flow from the liver back to the vein circulation and into the right side of the heart. Then the blood flow to the pulmonary artery to the lungs, then from the lungs to the left side of the heart, then out into the artery circulation. So that shows that a medication over the gut is safe. The learning point based on the video. The medication should be given in right time, dose, and route. The most effective dose will be cause the high risk of side effect, either it's in same dose. The route of administration have their own route to go through, but it is following the artery circulation system. So pharmacokinetic tree distribution is the next video, is a third video too. The term used in the video is purpose of distribution, process of distribution, for compartment that involves the distribution process, volume of distribution, and factor of distribution. The definition that I get in the video is the factor of distribution is blood and tissue binding, proteins pH, and perfusion. The body-related factors include body water, composition, fat composition disease, and binding capacity. Example of drugs intravenous that I should explain based on the video. IV will be placed in the blood plasma that will be bonding molecule. This molecule is protein. This process will be increase the blood compartment capacity and done the unbalanced capacity. The drug will be moved to the new compartment, will continue until the compartment balance. The learning point. The purpose of distribution is to balance the unbalanced capacity compartment. Identify the volume of distribution, VD, is a property of the drug, shows how much drug need to be in body together with the certain concentration in the plasma. Equilibrium constant has a number at back or front direction. A factor represent the balance of each compartment. So the fourth video is pharmacokinetics metabolism. The term has been used in the video is drug can be metabolized by oxidation, reduction, hydrolysis, hydration, conjunction, condensation, or isolation. Whatever the process, the goal is to make the drug easier to excrete. The enzymes involved in the metabolism are present in many tissues, but generally are more concentrated in liver. The definition term has been used in the video is drug metabolism often takes place in the liver, but metabolism can take place elsewhere, such as in the lungs or gut. The factor most drugs get metabolism is the liver is very important in pharmacokinetics. because drug can be oral, maybe metabolism by the liver before they range the systematic circulation. So the example of the drug that I choose is intravenous. Cytochrome P459 is a drug have attached hydrogen attached to it, have attached hydrogen to it. This hydrogen going to be the target through the process of hydroxylation. The drug has to turn the hydrogen into the hydroxyl group. The metabolism didn't stop there. The presence of the new hydroxyl group create a large molecule to be attached there. Many enzymes can be active in the new form that makes the drug can be easily excreted by the kidney. Please round the learning point. So the learning point is metabolism is the enzymatic modification of compound. It is a determinant of clearance, oral bioavailability, and half-life in vivo. Metabolism occurs predominantly in the liver, may occur in the intestine and other tissue. Drugs are metabolized through various reactions, include oxidation and reduction. So we are moving to the next. Pharmacokinetic 5, excretion. So the term has been used is excretion system and clearance. The definition of each term that used in the video is in pharmacology, clearance is a pharmacokinetic measurement of the volume of plasma from which a substance is completely removed per unit time. So the example of the drug that I choose is penicillin. Is intravenous. So conversely, the drug is to the nephron. This will increase the concentration and also the bad drug as an example of this drug penicillin. List down the learning point. The learning point is excretion is invisible, removing drug from the body. Different thing can be happen to the nephron depends on the drug. First order of kinetic and zero order kinetic. So thank you. I have a small quotes to say. It is easy to get 1,000 of description, but hard to get one single Chinese proverb. So thank you to Madam Wazuin to give me this opportunity to present. And thank you for my dear cohort students to see my video. Thank you.